The implications of what we're talking about are so far-reaching. It's not hyperbole. This is real stuff. This type of reactive oxygen species and stress has been implicated very specifically in dementia, in Parkinson's disease, even in autism, but also many other things like diabetes, cardiovascular disease, and things of that nature.
I'd love to do a deep dive into all of the ways that we can really optimize our sleep for better health, better immune function, more energy, and so forth. Dr. Seheult, tell me, how can we improve our sleep?
Well, we have to get to bed and go to sleep for one thing. But it's not as easy as that. I mean, you'll see a lot of times people will say, look, you got to get 7 or 8 hours of sleep every night. And so how does one do that? Realizing the constraints that we have, which is that we've got to get up at the same hour every morning. And so what do? We back calculate, right? You got to get up at 6 o'clock in the morning or 5 o'clock in the morning. And if you want to get 7 hours of sleep, instead of going to bed at 1 o'clock in the morning, you've got to go to bed at 10 or 11. And so what people will do, and, I hate to say this, but we tell them get 7 hours of sleep. What people will do is they'll just go to bed for the first time in a long time at 10 or 11 o'clock at night, expecting that they're going to go to sleep. And that's not going to happen when you're used to going to bed at 1 o'clock in the morning, because your circadian rhythm is off. So one of the big things that I really like to do, if I'm going to tell somebody to go to sleep, to get 7 hours of sleep, they've got to understand how are they going to actually do that. Because the absolute worst thing to do is for somebody to have insomnia when they go to bed, because now they're going to have anxiety about going to sleep. And it's something we call psychophysiological insomnia, which is you go into the bedroom, you can't sleep, you associate all of those bad things that you have normally with that bedroom. And so you may feel sleepy in the kitchen. You may want to go to bed, and you go to bed, and now all of those subconscious things that you've associated with the bedroom come flooding back, and you can't go to sleep. So all of that to say is we've got to find a way to advance the circadian rhythm that's used to going to bed at 1 o'clock in the morning. And one of the big things that we've been talking about over on MedCram, we just actually produced a video on light. And there's been a lot of talk about this recently, of course, just in the media and everywhere who wants to be healthy, is this making sure that you're not exposing your eyes to light after, let's say, 9 o'clock, or make it as low or dim as possible. And then on the flip side of that is making sure that you're exposing your eyes to bright lights in the morning. We talked about this actually on your last episode, is in doing that, you can shift the circadian rhythm back. So you start to feel more sleepy. You feel like you're ready to go to bed earlier. And so you can actually get the 7 hours of sleep that you're supposed to get, rather than going to bed and feeling bad about staying awake in bed. So that's just one point right there, but I'll stop there to see if there's any questions. It probably is, but
so many questions always with you. So many questions, because you bring the knowledge. You're such a powerhouse. How soon after waking up should we be looking to get bright, natural, ambient sunlight in through our eyes? And what dose are we talking about? How much time?
Yeah. So you want to do it as soon as possible, because, and I don't want to get too technical here, but the thing that everything revolves around is the temperature nadir. So if you really want to get into the holy grail of the circadian rhythm, everything that you want to do that moves that circadian rhythm revolves around this point called the temperature nadir. Now, how do we figure that out in science and research? Well, we put a rectal probe up and we measure it continuously, something that we're certainly not going to recommend that you do. I can see Apple Watch coming out with an app for that, but no, generally that's around 3 or 4 o'clock in the morning if you're not too shifted. Obviously, if you're going to bed much later at night, it could be 5 or 6. The point is that you want to expose your eyes to bright light after the temperature nadir. So after 3 or 4 o'clock in the morning. And so you can get up at 5 or 6 if you wanted to. The earlier you do it, probably the more powerful it is. Once you get around 9 or 10 o'clock in the morning, it's not as a powerful a stimulus. So as soon as you get up, exposing your eyes to bright light. Okay. The other question you had is how much. So we measure light in something called lux. If you want to get technical about it, a lux, if you were to get a candle and hold a 1 meter by 1 meter, which is about 3 feet, board 1 meter away from it, the intensity of that candle on that piece of board would be considered a lux. The kind of brightness that we're looking at is like, if 10,000 lux for about 20 minutes. So if you were to multiply it by lux hours, we're talking about 3,000 lux hours. So how fast you want to get that is up to you. You could go outside, and if the sun is up and it's a bright day, that's 100,000 lux. You could literally get that in 30 seconds.
Wow.
So that's the type of thing that we're talking about. Or, if you're inside, the sun's not up, and you're walking around your house, generally inside your house, it's about 50 to 100 lux, depending on how much light. It could take you quite a long time to get that amount of light. You know this working with cameras. If you were to, have the exact settings on your camera, taking a picture inside your home and then take it outside, it would look like a whiteout. The reason why we don't see that with our eyes is because our eyes adjust to light. But if you didn't do that, and if you actually looked, you would see that there are literally orders of magnitude more light outside your house than inside your house. And so what I highly recommend is for people to go outside their home when they get up in the morning, have coffee outside, tea, whatever it is that you drink, have it outside, make sure you're getting bright light. If you don't have that, if you're not able to get to the bright light, or you wake up early in the morning, or maybe you're living in the part of the world where the sun doesn't come up when you get up, then you can invest in one of these light boxes. And these light boxes, they're called SAD boxes because SAD is seasonal affective disorder. That's another thing that's associated with not enough light. But they generate about 10,000 lux per, and so if you need 3,000 lux hours, then all you need to do is sit within 15 inches of this light box for about 20 minutes in the morning, and you're going to get the amount of light that you need to get that circadian rhythm shifted in the appropriate way to get you the amount of sleep that you need.
That is fascinating. So what you're saying is, even if you turn on all the lights in your house, you're not going to get anywhere near the 10,000 lux required to anchor your circadian rhythm, correct?
That's correct. You need to get outside. And I'll just mention, by the way, that the receptors that we're interested in activating are not your rods and cones. This is not stuff that goes to the back of your brain in the occipital lobe where you actually see. These are things called intrinsically photosensitive retinal ganglion cells. This is what the scientists talk about. These things are not connected to your visual cortex. This is subconscious light that you are experiencing in different parts of the brain that have nothing to do with vision. So you may not see it visually, consciously, but it's happening in your brain.
Fascinating. Is this do you know if blind people have dysregulated circadian rhythms, or are they anchored by the light, since these are independent of our vision sensing cells?
It depends on what kind of blind people we're talking about. So these fibers that come from the intrinsically photosensitive ganglion cells ride along the optic nerve. And so if there is a severance of the optic nerve at that point, then absolutely, they are no longer entrained. They have this free floating circadian rhythm. It's like people living in the mines that have no entrainment. However, if people are blind because of a stroke in the occipital lobe, they're not going to be affected by this type of lesion, because those fibers of the intrinsically photosensitive retinal ganglion cells in the optic nerve are still intact. They're still going to the place that we call the suprachiasmatic nucleus, which is the master clock, which regulates all this stuff. And by the way, it's also going to another part of the brain called the perihabenular nucleus, which is part and regulated in mood and things of that nature. So the answer to your question is, if the blindness is in the eye because there's a problem in the eye, then the answer is yes, they're not going to get that photo entrainment. And by the way, interesting point. The effect at night that we were just talking about, when you expose your eyes to bright light, the same retinal ganglion cells shuts down melatonin in the pineal gland. What's interesting about that is, and we can talk about this, it's sort of related to sleep because it's melatonin, is that this melatonin is very, very important as an antioxidant in taking care of the body's processes, specifically with mitochondria and cells. But they have done studies where these people who are blind in the eye, and therefore they never, ever get a shutdown of that melatonin. And these blind people, believe it or not, are actually less susceptible, about 30% less susceptible to certain cancers.
Wow.
Because they are having full melatonin onset.
That is fascinating. Yeah, you tweeted recently, and I definitely wanted to bring this up, but you beat me to it, that we create melatonin outside of our brains during the day as a response to some aspect of the sun's rays.
That's correct. Near infrared radiation. I read this article by Zimmerman and Reiter. One of these guys is a professor at UT in San Antonio. The other one is a physics professor, and a light engineer. And it's not just them. There's this type of science has been going on for quite some time. What we're finding out is that melatonin produced in the pineal gland represents less than 5% of the body's melatonin.
Wow.
And as a result, what they're finding out is near infrared radiation from the sun can penetrate very deeply and probably hit the majority of the cells. Some studies that they cited up to 8 centimeters deep. That's about 3 to 4 inches. Okay, wow. Maybe 3 inches or so. If you can imagine 3 inches all the way around your body that this near infrared radiation can penetrate, go into the mitochondria and stimulate in some fashion the mitochondria to produce its own melatonin. And the question is why would you need this? First of all, this melatonin has absolutely nothing to do with sleep. It's not getting out into the vasculature. It's not telling your body, it has nothing to do with circadian rhythm whatsoever. But what it does do is melatonin is an extremely powerful antioxidant. It's twice as powerful as vitamin E. It actually, people talk about glutathione and NAC and all of this stuff. Melatonin actually upregulates glutathione.
Wow.
Okay. So glutathione we think of as the big boss antioxidant. Well, melatonin is the boss above glutathione. So why would this need to be? You have to understand what's going on in the mitochondria. In the mitochondria, you have these processes. It's like an engine. The purpose of a car's engine is to create locomotion, but as a byproduct of that, you make heat, and that heat, if not dealt with, can shut down the engine. And that could be a real problem. And that's the same thing what happens in the mitochondria. The mitochondria takes high energy electrons from products that you eat, like fats, proteins, and sugars, and it leverages those to make ATP, which is the locomotion, if you will, of the mitochondria. But in the process of doing that, these high energy electrons are floating around, and they can sometimes reduce oxygen in bad ways to make something we call reactive oxygen species, things like hydrogen peroxide, superoxide, hydroxy radicals. This is the heat, if you will, of the byproduct of the mitochondria. And these things are so reactive. They literally can move just a few nanometers or angstroms, if you will, and it will destroy proteins and break it down. In fact, this type of reactive oxygen species and stress has been implicated very, very specifically in dementia, in Parkinson's disease, even in autism, but also many other things like diabetes, cardiovascular disease, and things of that nature. What melatonin does right there on the site is it neutralizes that aspect of it. And so what you have, just to sort of bring it back to the big picture here, is you have a system in place. It's a cooling system for your engine, but it's timed so that at night, when there is no infrared radiation hitting your body, the pineal gland secretes melatonin so that it can basically continue to do what it needs to do at very low levels of activity. You don't need a lot of ATP at night. Your engine is not revving, it's idling. And so the amount of melatonin secreted from the pineal gland is commensurate with that. However, when you're up, active, out doing things, that near infrared radiation, because light, that same light that makes the melatonin in your mitochondria, is shutting down melatonin production in the brain. Now you have this burst of melatonin, especially early in the morning. It's beautiful in the morning because the sun is just coming up. You have more of the reddish hues instead of the bluish hues. That near infrared radiation can penetrate that long atmosphere that it has to come through so that your body is preparing. It's storing up melatonin ready for the onslaught of the day so that as that sun starts to go overhead, and now you have the infrared ultraviolet, I should say, light coming in, which can be very very damaging. The melatonin that you've stored up to that point for the first few hours of the day is now ready to protect and repair any damage. And then if any damage is done, as the sun is going down, ultraviolet starts to go down, it ebbs and goes away. And what we're left with is the beautiful red sunlight, rich in infrared radiation to complete the day. And then, of course, as we used to do 100 and 200 years ago, when the sun goes down, we might go to bed, we might make a little fire, melatonin kicks on in the pineal glands, and we're good. Let's fast forward to 2022. And instead, when the sun goes down, what are we doing? We're popping open our iPads and we're looking on our iPhones or our smartphones, and we're turning on the television, or we're exposing our eyes to bright light. We're turning night into day, and this is having a bad impact. Anyway, that's a long-winded answer.
No, I got goosebumps. I feel like this is one of the most important conversations that we've had on the Genius Life so far. I mean, what you're saying is that the amount, when people think about melatonin, they think about the melatonin secreted by the pineal gland. But what you're saying is that the quantity of melatonin produced by that region of the brain pales in comparison to what's produced peripherally in all of our cells by the mitochondria, and that it may actually be one of the most important anti-aging compounds that we produce endogenously in our own bodies, but it requires exposure to the sun in the morning hours and even the evening hours to be synthesized, to be created.
Yeah. And yes, you've nailed it. And the thing that you have to understand about the sun and the amount of radiation coming from the sun, when I talk about light from the sun, it's kind of a misnomer, because we're used to thinking of light as something you can see. But in fact, most of the energy that comes from the sun is, quote, light that you can't not see. And this is the mind-blowing part of it. It's absolutely mind-blowing. I was going to say this. You said that this is a very important conversation. I have said that this video that we produced on MedCram and the conversation that we're having now is probably one of the most important conversations and or videos that we've ever talked about, because the implications of what we're talking about are so far-reaching. It's not hyperbole. This is real stuff. And if you start to put, the 30,000 foot view, it's almost like, you're a frog in hot water and you're just sort of waking up and you're seeing the water start to boil. When you start to realize what has happened in the last 100 years, right? So we used to spend 50% of the time outside as human beings. We now spend 7% of the time outside. Right there, we've just narrowed down the amount of sunlight that we're getting exposed to. That means that we're not getting ultraviolet B radiation for vitamin D. And we're starting to see this now with vitamin D deficiencies. We're starting to see huge increases in autoimmune diseases, whether it's asthma, whether it's diabetes type 1, whether it's Crohn's disease or ulcerative colitis. All of those are autoimmune conditions that can be mitigated by vitamin D. There was just a paper that was just published literally days ago, Max, that showed that supplementation with 2,000 units daily of vitamin D over a 5-year period. This was a prospective, randomized, placebo-controlled trial, showed that there was a 22% reduction in all autoimmune diseases in that prospective cohort. That is a huge study. We've never seen anything like that before. But if you look at the graph of near infrared radiation exposure, sunlight exposure over the last 50 to 100 years, and you look at the incidence of autoimmune diseases, I know there's a lot of things that could be causing that, but it's tantalizing to see that connection, because we are starting to realize how those dots are connected.
It's fascinating. And yeah, the sun, I mean, we talk about vitamin D all the time, but vitamin D is just one aspect of it's just one of the many, many things that we get from the sun, right? We get these, depending on the wavelengths, right? UVB rays, when they hit our skin, that's what spurs our skin, right, to create what ultimately will become active vitamin D in our blood, right? The near infrared radiation earlier in the day, later in the day, we get this burst of melatonin apparently created in our cells. We also it creates nitric oxide under the skin that gets released and boosts blood health, vascular health. So it's amazing that there are all these ways, and these are just the ones that we've identified, right? That the sun helps to fortify our bodies, make us more robust and resilient. And yet some people try to distill it all down to a supplement, or,
Yes.
or even claim that we should stay away from the sun, right? Because it's, some will say that it's not good for us. And we touched on this on the last time that you were on the show, right? That some people will still maintain that there's no safe level of sun exposure today.
Yeah, I mean, this is the part that's really actually not controversial here, because, okay, let's say we have a patient out there who has a history of skin cancer or even melanoma, and his dermatologist had said over and over again, you need to make sure you cover up. I don't want you in direct sun exposure light. That's great. That doesn't affect this. I'll explain why. Because we've all done this, right? We're at the stoplight and the teenager pulls up next to us playing the thing they call music. and what do you hear? You just hear this boom, boom, boom. Why is that? Why is it that when we're very far away from a thunderstorm, all we hear is the low frequency rumble? It's because low frequency energy penetrates far distances. It can penetrate through things very easily. And that's what we're talking about when we're talking about melatonin production in the mitochondria. You don't need to have direct skin. Skin to light. You could be covered up. Look, go out on a sunny day, wear a t-shirt and put your back to the sun. Can you feel that? And the answer is absolutely, you can feel it. What's not happening there, it's not the visual light that's penetrating through the shirt. It's the infrared radiation that's penetrating through the shirt. It's penetrating through the epidermis, the dermis, and it's going deep into the tissue and exciting your heat receptors in your skin to say that there is heat. The same thing happens, by the way, when there's a fire in your fireplace or outside. When you feel that warmth on your face, you could be quite a distance away. It's not the air that's being warmed, it's the radiation that's permeating out in straight lines and it's hitting the skin. Now, the other thing I was going to mention is we have known for years that there are health benefits to being outside in the green, right? There's been meta-analysis done that if people are living in green spaces, they live better, they have better cognition, they have less depression, they have less anxiety, they have a better well-being. We've known this. This is something that we've known for a long time. Guess what outside? Guess what type of materials reflects infrared from the sun the best?
What type?
It's the leaves. It's the grass. Wow. In fact, I would challenge anybody listening to this to just go to Google, go to images and type in infrared photography. And what you will see will blow your mind, because you will see that the leaves on a tree look like there's snow on it. The grass in a wheat field will look like it's a snowstorm. These things are highly reflective of near infrared radiation. And so you don't even have to be in the sun. You could go outside in the shade. You could have lots of trees and grass. And if the sun is out, you're going to be getting plenty of near infrared radiation to do exactly that sort of thing. So we don't have to be in conflict with those that feel like direct sunlight exposure is going to cause a problem.
So you don't have to be shirtless, for example, to benefit from these near infrared rays.
That's correct.
That is very interesting. And from a fire, of a campfire, for example, or the fire from our fireplaces.
Check this out. So we talked about, we didn't talk about it, but I'll tell you that the intrinsically photosensitive retinal ganglion cells are concentrated mostly in the inferior retina. Now, if you know about human and optics, you'll know that the image gets flipped when it goes to the back of the retina. So the inferior retina is actually looking at things in the superior visual field. So think about this. The sun has gone down. It's cold out. It's 200 years ago. We're going to make a fire. Okay. So this is beautiful. Just think about this. First of all, it's red light. It's not blue light. These retinal ganglion cells they're sensitive to all kinds of light, but they're particularly sensitive to blue light. So this fire is not going to be stimulating as much as, for instance, the sun overhead. So number one, it's fire. It's red light. Number two, it's low down. Okay. It's on the ground. That's where the fire is made. And number three, it's giving off tremendous amounts of infrared radiation. That heat that you feel from the fire is infrared radiation. So it's like the fire in the evening is the perfect thing for your body. Just think back to the days that you may have had, gone camping and you had a campfire. How well did you sleep that night?
So well.
Yeah. I mean, it's just like, unless you're worried about the bear coming or something, but yeah, it's just really amazing. And if you, what I try to do is tell my patients, try to simulate, and it's not just me that says this, simulate what's going on, 200 years ago. So maybe if you need to have lights on at home at night, making sure that they're dimmable, making sure that maybe it's not the overhead lights, maybe it's night lights around the side at the bottom. Instead of looking at an e-reader, if you want to read at night, which gives us a lot of blue light and a lot of light, maybe just turning on a low dim incandescent bulb and opening up a book and reading a regular paper book. These are some of the things that you can do. But realize that near infrared radiation during the day is the kind of thing that you want. Now, there are some problems. Near infrared radiation is not found anymore in LED bulbs, at least the ones that you buy in the store. Those have eliminated all of the energy in the near infrared to make sure that we have enough energy, or we have low energy bulbs. So it's just visible light that we're giving off, no near infrared radiation whatsoever. Same thing with fluorescent bulbs and these types of bulbs. The other thing is that if you live in a modern home, almost all of the glass now has to be low E glass, which means that it does not transmit near infrared radiation. You can tell this if you go next to a window and the sun is coming in. If you feel the heat from that sun, chances are that it's not this new low E glass. But if you don't feel the sun, if you don't feel that heat, if you're just seeing light coming through, you're not getting any near infrared radiation. So the point being is that if you want near infrared radiation, you have to get it on purpose. You have to decide to say, here's an activity that I usually do in my home. I'm going to make a point to going outside of my home and getting that near infrared radiation exposure.
I love that. I'm sure it pales in comparison to the actual sun during dawn and dusk, but I have a red light emitting device, like one of these, I believe it's a near infrared wavelength light emitting device. And I have no financial affiliation with this company, but it's a Juve device, and I use it and I stand in front of it. And I'm assuming that it's the same idea, essentially. Yeah. At least that's what they're aiming for with this technology.
And it just depends on the purpose of what you're doing. If you're using it as light at night, so I would say the best thing to do is not to have any light at night. But if you have to, I mean, we live in the 21st century, so, we have to do things sometimes, is to limit that amount of blue light. So wearing blue blocker glasses or using a red light, like you just talked about. The worst thing to do is just to turn all the lights on and walk around as if it was nothing. I mean, they've done studies on this very clearly that when you expose your eyes to light at night, not only is there a delay in melatonin onset, there is less melatonin secreted during the night, and there is more sleep inertia the next morning. What do I mean by sleep inertia? It's like, hey, time to get up. I don't want to get up. That's sleep inertia. And that's worse when you're not getting that melatonin experience at night.
Wow. Man, so much good information. Actually, one very useful tip that I can offer listeners and viewers. I went to a local lamp store and I bought, because I have a lamp by my bed, and I don't use the overhead lights, and that's something that I stopped months ago. But in the lamp by my bed, I have a red light bulb. So it's just red. It's not white or anything like that. And it's the only light that I use in my bedroom as I'm winding down. And it looks like I have a campfire on in my room. Either that or it makes my room look like a strip club. But I like to think of it as having a campfire.
Looks like you're already changing your behaviors, Max. So it's you're living what you're teaching.
Yeah, my sleep is 10 out of 10. I don't think I could possibly improve on my sleep at this point. I've got it so dialed in, but I know that this is a big problem for many people. Many people struggle with insomnia. Let's talk about the difference between sleep duration and sleep quality. Is one better or more important than the other? Are they both important? And how can we improve on each?
Yeah. So basically it's the numerator and the denominator. The sleep quantity is the denominator, and the sleep quality is the numerator. You're never going to get that numerator up unless you also get the denominator up. And so the very first thing that I try to do with patients is to find out whether or not they're just not getting enough sleep because of stress, because of work, or whether or not they have ample time for sleep and they're just not getting the good quality of sleep that they need. So one of those is insomnia, and the other one is just short sleep time. If it's short sleep time, then as I mentioned at the beginning, I'm going to ask them to get more sleep. And if it's a problem where they have to get up at a certain end time and they have to sort of back calculate, we'll do that. But I also got to make sure that their circadian rhythm is ready to back up as well. So once they've been given the opportunity to sleep, then I check to see whether or not they're having that efficiency or that sleep quality. And that's really important, because this is where a lot of problems come in for me as a sleep specialist. People get referred to me all the time for this problem. Most of the people that I see are because they have obstructive sleep apnea. So obstructive sleep apnea is a problem where when you go to sleep, your airway goes to sleep, it collapses. You try to breathe in and the air is just not getting down into the lungs. Your oxygen levels drop. That sends alarm signals into your brain, causes a sympathetic nervous system discharge. And that's all related to a lot of cardiovascular problems, which is why it's a serious problem. And then your airway opens up, you start to breathe, oxygen levels resume, everything's fine. You go back to sleep and the cycle repeats itself again. And so I've seen people who stop breathing 30, 40, 50, even 100 times per hour. And it's pretty severe. So,
and what causes that? Being overweight, I'm assuming, is one possible cause.
Oh yeah. So being overweight is the classic one. Being male is the classic one, but you don't have to be a male. You don't have to be overweight. It has to do with just the anatomy of your jaw, has to do with, who your parents were, has to do with a lot of different things. And so we have ways to try to screen for that. Some of the things that are very specific for obstructive sleep apnea, if you or your bed partner is saying to you that you're not breathing at night, you're gasping for air, you're snoring, these sorts of things are clues that you could have sleep apnea. Other clues for sleep apnea would be having headaches in the morning. Another big one is excessive daytime sleepiness. So if you're driving and falling asleep, reading and falling asleep, watching television and falling asleep, these are all signs that you have something called excessive daytime sleepiness. They're not specific for sleep apnea, but they're very suggestive. And now in 2022, we have very good ways of testing for this. You don't have to go to a sleep lab necessarily. In most cases, we can do this even with something that you just take home and bring it back the next day to the doctor's office. But making that diagnosis is important, because you're never going to get the sleep that you need unless you actually get this thing taken care of. I have an ICU nurse that I work with, and he stopped breathing when he finally went and got this checked out. He actually didn't even talk to me. He knows I'm a sleep doctor. He talked to somebody else, a physical therapist. And they said, even they could figure this out. They said, it sounds like you've got sleep apnea. So he went and got tested. This poor guy stopped breathing 90 times per hour. He told me afterwards, he found himself falling asleep driving home. He would have conversations as a nurse in the intensive care unit with other people, and he would find himself falling asleep in that situation. When I saw him and talked to him, it was 5 days after he got treatment. In this case, it was CPAP, which is a mask that you wear that keeps the airway open. And he kept on saying over and over and over again, he said, "Dr. Seheult, it's like night and day. I had no idea how sleepy I was. I thought I was just getting older. I thought it was just part of getting older." And this guy's younger than I am. So, I mean, it's really hard sometimes to say to yourself that you've got sleep apnea, because it happens so slowly and you just feel like this is what happens when you get older. But the signs and tales are there. I can just tell you personally myself, I have sleep apnea and I wear CPAP at night, and I'm not exactly have a high BMI. I think my BMI is like around 22. It's just the way my jaw is and my mouth and my tongue, the way it's put together, just my genetics. I couldn't do anything about it. But I'll tell you, I was board certified in sleep medicine. And when I woke up one day on my couch, literally gasping for air, it was really hard to deny what was going on. And, I got tested, figured it out, and I knew I wanted CPAP. So.
Wow, fascinating. With respect to preventing apneas or at least minimizing them, is sleeping on your stomach the better than sleeping on your back? Or because I sleep on my stomach, and I feel like on my back I would be more prone to having my mouth hanging open and my tongue falling into the, you know what I'm saying? And sleeping on your stomach prone position, I know generally is considered to be, it's supposed to reduce the burden, right, on your respiratory system. Don't they put people in the ICU in the prone position when they're having trouble breathing?
Yeah, so no question about it that when people are off of their backs and even on their sides, or preferably even on their bellies, that the tongue falls forward away from the airway. And so generally speaking, yes, there is improvement in apneas for people who have obstructive sleep apnea. But in some people who's just overweight and they have just an overall narrowing of the airway, sometimes that's not enough to completely eliminate or to resolve or solve that problem. In terms of sleeping on your belly, we feel, bring forward the heart off of the lungs. And so there's better breathing. In someone who's completely normal and doesn't have pneumonia, it's probably a very negligible difference. But in someone who has, for instance, acute respiratory distress syndrome or COVID-19 pneumonia, we find very clearly that putting people on their bellies has a tremendous impact on oxygenation. It could be because of the aforementioned thing about the heart. But the other thing I think is probably more involved with this is that the lung is concentrated toward the back. If you were to look at somebody's lung, the lung takes up a lot of the posterior aspect of the thorax and just the minimal part of the anterior. So when you're laying on your belly, the majority of the lung is sitting up top, and a lot of that liquid and pneumonia starts to settle down and come down in terms of gravitational, and allows a lot of the oxygenation to occur in more of the lung. And so it's felt that might be related to that. We're not exactly sure on the details of the physiology, but there's a lot of theories.
Super interesting. Yeah, I love to sleep on my stomach. I can't sleep any other way. And I've been told by people in the functional movement space that laying on your back is best for your back. And so there have been times in my life where I've tried to learn to sleep on my back and I just can't do it. But it makes me feel good hearing this, obviously, because, sleeping and breathing well while you're sleeping is so important.
Yeah, I mean, most of the other mammals in the mammalian kingdom sleep on their bellies, right? They sleep with their bellies down. I don't know of any animals other than humans that sleep on their backs.
I'm just not comfortable on my back. I've tried. I love sleeping on my stomach. So when it comes to the different phases of sleep, so, slow wave sleep, we've talked about in the previous, your previous appearance on the show, REM sleep. What about optimizing each different phase? Is there a point to even discussing that? Are there practical ways to improve, for example, if our sleep tracker says we're not getting enough REM sleep?
Yeah. So the problem is that it just has to happen. One of the big things is sleep apnea. Sleep apnea is that thing that will kick you out of whatever sleep you're in and bump you up into 2 or 1 or even awake. So to the degree that you want to improve either slow wave sleep, which is otherwise known as N3 sleep, or REM sleep, to the degree you want to improve those, you got to make sure that you're not having sleep apnea, because that will just kill any of those type of sleep. Also realize that N3 sleep is going to happen towards the beginning of the night. And so getting to sleep in the earlier portion of the night, where N3 sleep exists, would be important. N3 is very physically restorative. It's also coupled, as we talked about before, with growth hormone. And that is very important in terms of what they thought was the fountain of youth, this growth hormone aspect where it sort of just does everything good. You feel energy. So that's a physically restorative. Whereas the REM sleep is more along the lines of the mentally restorative type of sleep. It's where you dream. It's where memories are processed and things of that nature. That's more towards the end of the night. You will get your first REM sleep 90 minutes in. It's very short usually. And it's more concentrated. People will know, for instance, that when they dream, it's usually right before they get up in the morning. That's where REM sleep is. And the problem with REM sleep is that you dream, number one. It's not a problem, but the problem is that when you dream, you want to act out those dreams. And so as a safeguard against that, your body basically switches off your motor function. You are essentially paralyzed in REM sleep. Now, that's not a problem. That's what it should be, because you don't want to be like crawling out of windows and going up and down stairs. But realize that there is a motor aspect to your airway. And so you want to keep that airway open. And so when you go into REM sleep, this may be the period of time, if you don't have sleep apnea, that you might actually have some sleep apnea, because this is the point of time where the respiratory system is very unstable. This is the point of time where the respiratory system and the airway collapses the most because you are paralyzed. And so I've seen people, for instance, where they'll go the whole night without a problem. And then they go into REM sleep. On the sleep study, I can see it very clearly. They go into REM sleep, and then we see all of these apneas. So they essentially have REM sleep associated sleep apnea. And if their period of REM sleep is so short, then it's not going to cause the entire study to be positive. And so what do you do in those situations? We see this a lot in middle-aged women. And we see this also causing low energy, fatigue, fibromyalgia. These are very common complaints in that population. And so I would say that it's very important to get that followed up. For instance, we see with men who have heart attacks, we have the very classic symptoms of Levine sign, of pressure in the chest radiating down the arm into the neck. And that's how we recognized it. That's how we identified it. And then women, unfortunately, they come in with very different symptoms. Maybe they have some atypical chest pain, but for them, that's the heart attack. That's the symptom that they have. And so science woke up to that and realized, hey, women and men present differently. These are not classical symptoms. We're missing a lot of women with heart disease because we're not recognizing it. Well, that's exactly the same situation with obstructive sleep apnea. The snoring, the apneic, the witnessed apneas at night, these are classic symptoms that we see in men. However, with women with sleep apnea, they may get it only during REM sleep. They may have mood disturbances. They may have fibromyalgia. Instead of sleepiness during the day, they may have fatigue. And so we have to be cognizant of that when we're looking at the individual to make sure that we're identifying it. So in answer to your question, how do we get more slow wave sleep? How do we get more REM sleep? We create an environment where those type of sleep patterns flourish. So going to bed at a reasonable hour and making sure we're eliminating things that disturb our sleep, I think are the key ways of doing that.
Yeah. So speaking of things that disturb our sleep, let's talk about some of them, like caffeine, for example, or alcohol, or maybe eating too close to bedtime. Is there any merit to stopping eating an hour or two before you go to sleep?
Absolutely. So yeah, where do we even begin on that? Well, we talked about time-restricted eating last time we were on the show. And, this sort of goes along with the fact that when your body is going into sleep mode, it's best when everything is timed according to the circadian rhythm to not be going into eat mode. And so when you put that last piece of morsel of food into your mouth and you say, I'm done, it's not like your fasting state begins right there, right? Because the food may not be in your mouth, but it's in your stomach and your system is dealing with it. It takes about maybe an hour or two to get that out. You can speed up that sometimes by exercising, but there's people that say maybe you shouldn't be exercising right before bedtime because it excites your senses and it's hard to go to sleep. I think exercise in the evening is better than no exercise at all. But the point is that you really should not be having food, at least I would even say 2 to 3 hours, especially for people who have gastroesophageal reflux disease. That's a huge problem. Let me just expand on that. For people who have reflux, that stuff basically refluxes, the stuff in the stomach refluxes up the esophagus. And what happens when you're awake is a peristalsis movement that tries to get that thing back down into the stomach. That's what happens when you're awake. When you're asleep, that does not happen. And so this stuff can reflux up. It stays in the esophagus. You're trying to breathe in against a closed glottis, creating a negative pressure back there in your area, in your airway, which can be transmitted to the esophagus. So you're pulling stuff up even the esophagus, and that can cause a bathing of the larynx with acid stomach secretions that can lead to asthma, that can lead to coughing, that can lead to sore throat, even dental enamel erosion. There's a whole host of issues.
Yikes.
That can happen when you're eating too close to bedtime. So making sure that you have a very light meal in the evening, making sure that there's a good amount of time between when you eat and when you lay down to go to sleep, I think is very important in terms of that. Now, you asked about other things that can disturb sleep.
Caffeine, alcohol. Food. I feel like these are the big ones. Yeah.
Yeah. So alcohol is a depressant. So you might think, wow, this is great. Let's drink alcohol before bedtime and it'll put me to sleep. It'll take away my anxieties and my nerves. And you're correct up to that point. The problem with alcohol, though, is that it's extremely short acting. Like within an hour or two, it's washed out of your system and you actually have this small state of withdrawal. You might not think that you're actually withdrawing from alcohol because you haven't experienced those type of symptoms. But sleep is so delicate that even as that alcohol is withdrawing, it's going to bump you up out of that nice deep sleep that you might be having. And it's going to make it more difficult for you to have deep sleep. Also, let's couple the fact that when someone has sleep apnea, for instance, when that oxygen level goes down in the body, there is a signal to the brain to tell the brain that says, hey, the oxygen level is low. Let's wake up the oral airway muscles so that we can get more oxygen. Alcohol impairs that reflex. And so what happens in people who have sleep apnea and also drink alcohol at night is those oxygen levels drop even lower before that signal is reached and the airway is open. So you can have much longer apneas, you can have much lower saturations. And of course, this wreaks havoc with that as well. Caffeine. Okay, so caffeine.
Well, before moving on to caffeine, so for people that do choose to imbibe, what would you say would be a good sort of happy medium, a way to do it mindfully and that in a way that compromises sleep as minimally as possible?
I don't know of the minimal amount. I'm not aware of the minimal amount of alcohol that you can take that's not going to affect that pathway.
Would you say that if you're going to drink, though, sober up completely before going to sleep?
If it's possible, yes.
If it's possible.
So in other words, and the only way to really do that is to, just from my knowledge of first rate order metabolism of alcohol from medical school, is you just need time. That's really what you need. And for women and men, it's a little different because, as we know, men have more body water, which is obviously what the alcohol is dissolving in. So as a result of that, pound for pound, men have more body water to absorb that alcohol and won't be affected by it as much, generally speaking. So just be aware of that.
Wow. Really good to know. Yeah. And also drinking more water while you're drinking, consuming the alcohol, maybe, replenishing electrolytes. I don't know, just my hypothesis, because the solution to pollution is dilution, right? So
that is true. Although that reminded me of another saying, if you have one drop of sewage in a 8-gallon container of water, what do you call it? Sewage.
I like that. That's true. That is true.
But you're right. Actually, you are actually correct. I used to live in a city where they had an issue with some toxins in the water. And the way that the city dealt with that toxin was to bring in water that did not have that toxin in to dilute out that toxin to a level that was within the level of the EPA. So you're absolutely right. The solution to pollution is dilution.
It's not a best case scenario, but people are going to drink. So I feel like it's good to offer practical compensatory tools.
Absolutely.
But yeah, moving on to caffeine. This is a big one.
Yes. So I don't drink caffeine, so I don't have any personal experience with this, but I guess there's caffeine in sodas. So I guess I might have it occasionally, but I try to limit that. Here's the point. The point is that as you go throughout the day, there is a substance in your body called adenosine, which builds up. It's actually the drive to go to sleep. And so it helps when you are about to go to sleep at night. So this adenosine is increasing and increasing and increasing. It's this drive to go to sleep. So why don't we just get sleepier and sleepier as the day goes on and on and on? The reason is because of the circadian rhythm. The circadian rhythm is the counterbalance to that, so that as you would be getting normally sleepier and sleepier from adenosine, the circadian rhythm is pushing you up. And you a lot of, maybe you feel this at around 7 p.m. It's kind of, you feel alert and awake at 7 p.m., whereas at 5 o'clock, maybe not so much. This happens a lot in Europe. European cultures are very old cultures, and they're very in tune with these circadian rhythms. As you may know, it kind of dips in the afternoon. You have the siesta. And then what happens? The doors throw open, the businesses are open, everyone's partying on the streets at 7, 8, 9, right? Because circadian rhythm is pushed up. As soon as circadian rhythm turns off, it's kind of like, whoa, what just happened? You have this tremendously high adenosine levels, and you're ready to just go to sleep. That's the way it should happen if you lived on a desert island and you were perfectly in tune with the sun coming up and going down. Here's the thing that'll be important for people to understand. The adenosine is affected by at least two processes that I'll mention. First of all, when you take a nap in the afternoon, that adenosine level that's rising starts to come down. And so when you stop taking your nap and it starts to go back up again, it's never going to be at the level that it would have been if you hadn't taken the nap. What's the other thing that drops adenosine levels? Caffeine. Caffeine is designed to drop adenosine levels. It seems like it's an inhibitor, right? So that adenosine that would normally be there gets propped down. So adenosine inhibitors, caffeine, they have a half-life. I can't remember if it's about 3 or 4 hours half-life, 2 to 3 hours. Generally speaking, if you look at pharmacology, to get something completely out of your system requires 3 to 4 half-lives. So you do the math. If you're drinking something with caffeine or coffee in it, even in the mid-afternoon, that's going to impact potentially you going to bed at night. So if you're going to drink caffeine, do it in the early morning. But here's the thing that I see all the time, Max, is that people don't start out drinking coffee because they like it. It grows on them. But people are usually drinking coffee because they're sleepy in the morning. They've got to wake up and do what they need to do. And that is the result of everything we've just talked about up to this point, is they're not getting enough sleep. It's not good quality sleep. They're on their iPhones or iPads. That sleep inertia is a problem. So they're having to fix it by drinking something in the morning to wake them up, not realizing that this is creating problems again at the next cycle. So
is this adenosine buildup responsible, at least in part, for what is known as sleep pressure, the sleep pressure that builds up over the course of the day?
Exactly. That's what it is. So there's two processes. There's process S and process C. What do they stand for? Process S is homeostasis. Okay. Or process H, if you want to call it that. It's this, we're all familiar with homeostasis. You're thirsty, you drink. You're hungry, you eat. That's this homeostatic, adenosine driven sleep process, where as you go throughout the day, the chemicals in your body that are building up are saying you need to go to sleep louder and louder and louder. Just like the further you go away from eating, the more hungry you become, the further you away of waking up, the sleepier you become. The thing that prevents you from being sleepy, as we talked about, though, is the circadian rhythm, which says, no, we are going to battle against that adenosine and we're going to keep you awake until the hour of sleep. And then we're going to pull back. And then all of a sudden, just like, boom, I'm ready to go to sleep. And that's that adenosine drive.
So interesting. Are there any foods that can potentially help with sleep? I mean, we talked about caffeine hurts sleep, alcohol hurts sleep. Are there any ingestible compounds that you know of that actually improve sleep quality?
This is something that I need to do more study on, but I can tell you there are some stimulating types of foods that are potential problems. And I'm thinking about the types of things that they put in flavorings. You might have it in potato chips, MSG. You might have it in foods, salt foods, monosodium glutamate. These sorts of things. These are neurostimulators that are designed, and they put them in there, these processed foods, to make it taste better. So these stimulating types of foods, and what are they? As I mentioned, a lot of these things are chemicals to make things taste. Have you ever noticed you eat a chip and you're just like, man, I need another chip? Or Doritos. I hate to name these things, but I love Doritos. But you can't just have one chip, right?
Of course not. Like once you pop, you can't stop.
That's right. So, I don't have offhand right now the data that would say, yeah, these are the things that keep you up. But in my own personal experience, when you start to eat some of these more stimulating types of foods, they may increase your chances of staying up at night. So again, if you're not eating within 3 hours of going to bed, it's less likely to be an issue.
Yeah, that's a great point. I certainly am guilty of the late night snacking, and when I open up a bag of one of my favorite indulgences, whatever that happens to be, I mean, I feel like this month it's like these grain-free pretzels that I've been just like obsessed with. I could go through a whole bag, but yeah, it's really hard to stop once you get that train rolling. This is a question that came from the audience, but it has personal relevance to me too as I approach the age of 40. But I have to wake up almost every single night to have to pee. And some in my audience, when I told on Instagram, when I told my tribe that I had a sleep expert coming on, people asked, had a lot of questions about why do I pee so much at night? Some people wake up 2-3 times to go to the bathroom. I feel grateful that for me, it's only once a night, but anything to do to minimize that. Is that as detrimental as it would seem, having to wake up every single night?
So let's just take off the first layer there. So make sure that this isn't a prostate problem. In general, I'm not talking to you because at 40, you probably don't have a prostate problem, but in general, in people who are in their 60s, 70s, and 80s, look, let's face it, men have prostate issues where the prostate has grown so much and has hypertrophied so that you can't empty your bladder. And so that's a very common cause in men of having to urinate at night. Women also can get urinary tract infections or bladder instability. This can also cause them to go urinate at night as well, multiple times. We call this polyuria or nocturia. However, I'm glad you brought this up because one of the signs of obstructive sleep apnea is nocturia. Now, let me tell you how this all fits together in my head. So I remember years ago when I was in medical school, and it always seemed to be on the days that we had the big tests. When we had the big tests at Loma Linda, we'd go down in this basement in this hall, and it'd be these cubicles, and we'd all sit there, and it's on a test for the last 3 weeks that you've studied, and you're nervous. You've got a lot of anxiety. And I know this, that your cortisol levels are high. When under your stress, your cortisol levels are high. Here's the thing about cortisol. Cortisol inhibits the body's ability to reabsorb free water in the kidney. So let me say that again. Cortisol diminishes the kidney's ability to reabsorb free water. So what happens is that free water that would normally be reabsorbed back into the body gets dumped into the urine. So what people typically will have when they have a lot of cortisol or they're about to take a test, I always notice this on the days that I'm going to take a test, I got to go pee. Normally when I don't have to go pee, this is when I got to go pee. And of course the urine is very light colored because it's got a lot of free water, and you know that your cortisol levels are high. Okay. So what does this have to do with sleep? People who have obstructive sleep apnea, because of the airway issues, because of the sympathetic nervous system drive, their cortisol levels are amped. And as a result of this, they actually, in some cases, pee more at night than they do in the day. And the reason is because they're running the gauntlet at night. Their body literally saying, we're in danger mode. Every breath is compromised here in some of these cases. So cortisol levels go up at night. You're not reabsorbing free water, and that bladder fills up very constantly. Here's the thing that's amazing. When I have these patients that come in, they've got sleep apnea. They say, "Doc, I can't wear this mask. I go to the bathroom 3 or 4 times." I said, "Trust me on this. If you wear this mask, I bet you won't need to go to the bathroom." And that's going back to that guy that in the ICU. That's what he said. He said, "I was going to the bathroom all the time, like 3 or 4 times." He puts this on, he's not going to the bathroom anymore. And it's because cortisol levels are down, the body's able to reabsorb that free water, and your bladder is not filling up. If I had a dime for every time somebody said that their nocturia went away after we treated their sleep apnea, I would be rich. You know how I'm always going to end that sentence, right? If I had a dime.
Yeah.
But I'm telling you, nocturia is a big thing. So if somebody's complaining of nocturia and they've got a prostate problem, look into that. That's probably the low-hanging fruit. If somebody has a lot of urinary tract infections or medical issues, look into that. That's low-hanging fruit. But if maybe you're a little bit overweight, or maybe, your spouse says that you're snoring at night, and maybe you've gained some weight recently in the last couple of months, and you're going to the bathroom a lot at night, it could be all connected.
Wow. Is it likely? So for somebody, I mean, just, selfishly asking about me, I don't believe that I have sleep apnea. I think my prostate's fine. I'm not prone to urinary tract infections. Is it possible that for somebody without any of those three things, that maybe they have slightly higher levels of cortisol at night than they should? Is that a possibility? And if so, are there foods that could, maybe like carbohydrates, like a rapidly digesting source of carbs before going to bed, that can help bring the cortisol down or something? I'm just talking out of my butt, but is that a possibility?
It's possible, but all of those things that I'm aware of that could potentially cause that problem are much less likely than sleep apnea. Sleep apnea in the male population is 15%.
Wow, that's common.
It's very common. And that's with symptoms. So, it's probably even more than that. What I would recommend doing is just getting it checked out. It's easy to do. It's not hard. Even if you don't want to, we have something called a home sleep test, where they put a device on your head. You go home and you sleep, you bring it back the next day, and they can tell you whether or not it's obvious whether you not have sleep apnea. But you don't even have to do that. You can even wear a watch. They have a watch that is hooked up to your finger, and it records your pulse oximetry throughout the whole night. And if you've got one of these things where it looks like an earthquake, where it's going up and down, that's very suggestive of obstructive sleep apnea, because there'll be periods where your oxygen will be fine when you're breathing, and it'll be down into the 80s when you're not breathing, or even 70s I've seen. So,
wow, that is shocking. Are you aware if any of these consumer home sleep tracking devices, like there's the Ring that people are wearing or the bracelets, are they sensitive enough to detect apneas, or are you familiar with those technologies at all?
There is proprietary algorithms that, even though they don't look at the oxygen and they don't look at the breathing, they can still pick up the potential presence of apneas based on the irregularity of the pulse. It's a very sophisticated thing that they do, but they can, some of these things, what may even actually tell you or alert you that you should probably get checked out for sleep apnea. But the way to do it so that your insurance company would say, yes, this is definitive enough, we're willing to pay for treatment, would be to get a home sleep test.
Home sleep test. Wow. Makes a ton of sense. Well, thank you for that.
Yeah.
It's really not that disruptive in my life. I mean, I wake up, I wake up, I go pee, and then I get right back to bed. Like, yeah. I don't have it doesn't cause me any insomnia or anything like that. So yeah, but just had to ask.
I was just going to say, it's important that if we are going to make the diagnosis of sleep apnea, it's important for longevity to make it early. All the indications have that when we intervene in this disease, it makes a difference if we're intervening in people in their 40s and 50s rather than in their 70s and 80s. So for people who think they may have it, better to get it checked out and look from there. We know that as you get older, the incidence of sleep apnea goes up. It's just a fact of life that the tissues aren't as, let's say, firm as they used to be. I think this goes for just about everywhere on the body.
Now, is it always correlated with like snoring, or can it be completely silent?
So if somebody the answer to your question is, if somebody doesn't have snoring and they're having normal weight, the chances of them having sleep apnea are pretty low. But if somebody has snoring, you can't really tell, because snoring, as you know, is actually the evidence that air is moving. And so the fact that air is moving tells you that it's not sleep apnea. It's what happens at the end of the snoring. And I could demonstrate here very easily. I mean, you can go, right? Or you could go, that means something has stopped. Something is not happening anymore. And probably there's some apnea there.
Wow. Very interesting. Thank you for demonstrating that. That was a,
Yeah.
that was a
I'm an expert on that because I actually have sleep apnea. So
with regard to sleep apnea, mouth taping, nose expanding strips, are any of those viable at-home treatments?
yeah. So the breathe right strips, the nose strips, those are outstanding. Those actually can help a great deal. I don't know if it would completely eliminate the need, but I can tell you personally that nose breathe right strips are great. In terms of mouth taping, I would not recommend that because that's kind of the escape mechanism. So if you want, now that's not to say that a chin strap wouldn't be a bad idea. So mouth taping, not a good idea. Chin strap, a pretty good idea for those people though that have problems only when they're on their back. And we have some of those. We know that because we have them sleep in the sleep lab, or the home test actually has an accelerometer in there so we can tell what side you're sleeping on, or if you're even sleeping on your belly. Let's say that we've got somebody that only has sleep apnea when they're on their back. And if they can avoid their back, they wouldn't need to have any other help. There are some people like that. You can get a tennis ball or two and sew it into an old t-shirt and then put it on. So that kind of reminds you that at night, if you're sleeping on your back, you're kind of reminded to get off your back. And that's one way of dealing with it. Another way of dealing with it is with a dental device. So this is something that I love to demonstrate. I tell people, try to snore just normally. I can do it really easily just because of the way my mouth is. But if you take your two fingers and put it behind the mandible of your jaw and push it forward, like you're trying to move your bottom teeth in front of your top teeth, it's really hard to snore. It's almost impossible if you do it right. And what we're doing there is, because the tongue is attached to the mandible, if you move the mandible forward, and this is a synovial joint up here with your temporal mandibular joint where your jaw is, so it's able to move. If you move it forward, the tongue moves forward as well, and it opens up that airway significantly enough so that you can actually treat sleep apnea just doing that without having to wear a mask. The drawback, though, is they use your teeth as a traction because you're wearing a dental device, which is very similar to what athletes would wear. And when you're putting traction on those teeth, they can move. You can also cause some issues with TMJ in some patients. So that's another option.
Yeah. Wow. So much good information. When it comes to, the conditions of your bedroom, we talked about keeping it dark. Are you a fan of blackout curtains?
Yeah. I mean, anything that you need to do to eliminate light. So if you live in the country and it's pitch black outside, you probably don't need that. But if you're living downtown and there's a lot of lights outside, you really want to make sure that light is not coming in. I was surprised when I read recently that even light with the eyelids closed can actually, there's enough photons that can get through that will stimulate these retinal ganglion cells and shut down melatonin production. So wearing one of those things over your eyes, those eye patches to prevent light from coming in, can be very reasonable and good. I've seen on the internet, there's a video where it's called light. It's like a night light for kids. And I shudder to think, I mean, here you're having kids at night sleeping and you put a nightlight in their room, you're potentially shutting down their melatonin production. And, I know that there have been actually leukemias and lymphomas that have been associated with night lights. I don't want to scare anybody, but I'm very serious as a sleep physician. When it comes to the bedroom, you really want to eliminate any kind of lights in that bedroom so that it's as dark as possible.
Wow. Yeah. I'm somewhat familiar with some of those studies showing that even 5 lux can impair next day cognitive function, which is very counterintuitive and surprising.
Yeah.
Wow.
Yeah. And I would also mention, whenever we're talking about this, and when I do it on our videos, and I'm sure when you do it on yours, there's those people out there that feel like they're in no man's land, and it's the night shift workers. Like, what are we supposed to do? Right. So, what I would say for them is you really need to make sure, first of all, hopefully you're a consistent night shift worker. You're not getting like all these different shifts that you've got to sort of shift your circadian rhythm. If you're a night shift worker, you should stay a night shift worker throughout the entire week. So if you're 3 days, you're working the night shift, make sure the other days of the week, you're also doing quote night shift. If it's daylight outside, you're going to really need to have those types of blinds that shut out the light. And you're going to need to get up like you would normally do and live your life. you're basically living with your circadian rhythm, where on the other side of the planet, basically. And you're doing this to make sure that you're getting all of the benefits. So you're not going to get the near infrared radiation from the sun unless you get it some way artificially, either with a fire or an LED light that makes near infrared radiation. They're starting to make those now, actually. And so for night shift workers, you've got to be consistent. You cannot confuse your circadian rhythm.
Yeah, thank you so much for bringing that up. Because, some of society wouldn't run without night shift workers, right? Like some of our first responders are night shift workers. And it's important to underscore that night shift work is not necessarily a death sentence. You just have to, like make a few concessions here and there to make sure that you're not perturbing your circadian rhythm too much. Hey guys, if you enjoyed that conversation, you're going to love this one. How can we maximize our morning routine for better health?
Well, I think a starting point for that would be thinking about your morning. The morning routine is going to start with the evening.
Interesting.
So your evening setup is what prepares you to be able to open up, wake up, and actually be ready to engage with the day. So something that I think is invaluable for preparation for the morning routine is to create a list of what it is that you want to be pursuing for that day. So, and also just having a moment of stillness, before going to bed. So kind of throughout our lives, I think we're really filled with minutia throughout the entirety of our days. And everything is just kind of rolling on top of the next, on top of the next, on top of the next. And having some type of specific anchor points throughout the day, I think is absolutely invaluable. So meditation is a really obvious one for that, but it could also be like taking a walk. If you have a dog, dogs are such an amazing tool for catalyzing healthy practices.
What about cats? Not so much.
Less. Well, they're helpful for touch.
Yeah, they are. Oxytocin.
That's
a big thing.
There is some research about touch, and we'll stay focused on the thread of the morning stuff. But there was research on University of Miami that demonstrated touch to be helpful with children, babies in incubators, so preemies. The researchers just offered 15 minutes of touch 3 times a day to the babies in these incubators, and they found they grew, I think it was 53% faster than the other children that were untouched, uncontacted. And they were able to be released obviously sooner since they were growing and metabolizing food more efficiently. So it's such an interesting conversation of how we, you talk a lot about nutrition, obviously, and so many other things. But I think that even touch and, environmental conditions, textures, like right now I'm wearing this awkward, silly shawl that's incredibly comfortable and soft. That affects the way that we feel. So I would think of, in addition to all of your amazing work, I would add in touch as literally almost like a physical nutrient in a way.
Vitamin T. Wow, I love that.
Vitamin T. Yeah, at least with preemie babies. So the night before starting off, get yourself organized. So get your house clean is a really important thing. So like each day having a punctuated end of the day, like period set, like cool, that was the day. I think something that's incredibly valuable as well. And there's been a ton of research to suggest that just having some type of punctuated gratitude practice, so which could also act as an anchor point. So at the end of the day, reflecting back and saying, what did I do well today? I think that's a really powerful practice to get into, because most of us are so habituated towards how do we mess up? How do I suck?
Right.
Why am I a loser?
Yeah.
So starting to rehabituate that mental chatter. William James called us bundles of habits. So William James, he was widely known as the father of modern psychology. So we're just these bundles of habits, and throughout the day we average 60 to 80,000 thoughts each day, and typically most of them are just reiterations of yesterday and last week and last month and last year. Do you ever think about that? How consistent your thoughts are?
Oh yeah, and how inane half of them, at least, are about things that I'd rather not think about.
Right.
It's one of the reasons why I think meditation is so beneficial. And I'm not, I'm a very novice meditator. I meditate when I can will myself to do it, but I found it to be very helpful in terms of directing my attention off the thoughts I'd rather not have and back into the present moment.
A more sometimes I think meditation can be conflated with very like almost like feminine, kind of like soft. Like it's not. You don't see a lot of dudes meditating on the cover of Muscle and Fitness.
Right.
It's kind
Interesting.
of like,
Yeah.
it's kind of like, ooh, it's for emo people or chicks or, but it's an incredible, like from a masculine perspective, which masculine doesn't relate to genitalia. It's just, a quality, but a masculine lens on meditation that I like is I like to gamify it, and think of it. It's like almost like you're like sharpening a blade, but instead of sharpening a blade inside of your kitchen with a stone, you're sharpening the blade of your consciousness and your capacity for attention. So when you are in a practice of meditation, which I think a lot of people don't understand, and I still have a lot to understand about it as well, but it's really as simple as picking a point. In like yoga speak, they might call it like your dristi if you're doing like a movement practice. You're like picking a point in the room. Um, your the point may be your breath, anapanasati,
Or like a mantra, right?
or a mantra, or a candle, or I mean, it's just pick a point. And I think that there's a lot of maybe debate, unnecessary debate of like whose mantra or dogma or practice is like the best. I think from a mental, cerebral perspective, it's really just finding a point, allowing your mind to do what it does, which is wander to this thought and that thought and the next one, and then consciously engaging back onto that point. So you could start a really amazing meditation practice just looking at a water bottle. There's a water bottle sitting on here. I'm just focusing on the water bottle, and then suddenly I start thinking like, oh, this is kind of boring looking at this water bottle. Oh, okay, come back to the water bottle.
Hmm.
Oh, I probably need to go take out the dog, whatever thing. It's like, oh, come back to the water bottle. And doing that for, 12 minutes that's like a really, as far as like a low, what's the minimum viable, what's the,
Product. Yeah. Minimum
yeah,
viable product.
yeah. So that's like at the low end, that's a really great benchmark to get to 12 minutes.
Wow.
What is her name? Did you have Dr. Amit? She did Rogan's podcast.
Mishi Jha.
Mishi Jha.
Yeah.
Yeah, that's her.
She was great. She's been on the show.
Okay, cool. So that was her. I'm borrowing that from her.
When
And
she
so-
borrowed that from Vedic meditation, which is something that humans have been practicing and perfecting for millennia.
yeah, yeah, exactly.
But I think what's so useful about it is that it brings you into the present moment, which is, I think, useful, especially in the context of anxiety and depression. Anxiety is obsessive worry about the future, and depression is excessive rumination about the past.
Mm.
And so, what an easy way to dissolve worry, right? But to bring your focus back into the present moment.
Yeah.
And that's what I think meditation offers.
Yeah, yeah, but I think that like making it be like gamifying it, I think is an incredibly valuable tool and approach. At least for me, I found that to be really helpful.
Yeah.
So as opposed to I'm doing this spiritual thing, I'm meditating, I'm like waiting for some transcendent samadhi, like it's like, literally all it is you playing the game with the mind drifts away and you come back to that. Mind drifts away, you come to that, back to that, and eventually with time, you notice it starts to feel a little bit easier and actually feels like joyful. And then, Sam Harris talks about this where, he comes from a Vipassana background where it's like hours of meditation each day. Traditional Vipassana, like the initial one, when you go for 10 days, you get up at like 4:30 in the morning, you meditate for an hour, then you take a little walk and you do that for 10 consecutive days. And then eventually you can start to almost like own that state and be able to start to integrate that into your daily life. So after
Wow.
doing several Vipassanas, eventually they allow you to do a walking Vipassana, where you're starting to integrate meditation into just taking a walk around some stony path for a while. But it's laying that foundation of clarity, of focus first, and then from there you can kind of build out. And so having those anchor points throughout the day, there's just endless amounts of evidence to suggest that it's helpful with pretty much every biological marker to indicate health. But it's a really beautiful practice to start to create some separation from this day to that day, and et cetera.
Yeah. So 12 minutes, you would say, before bed helps prime the pump for an optimal morning?
12 minutes before bed, and also including with that a breakdown of just like a going back and kind of having an audit of your day,
Hmm.
and I think specifically coming from a place of, what were my wins today?
I love
What did I
that.
enjoy about today?
Yeah.
And I think that that's something that like a common conversation now is in the space of longevity.
Hmm.
We're trying to live to 150 years old, or live forever. And
Yeah.
it's like, if you're not excited about your existence, like what are you living for exactly? And within that space, I don't hear much conversation around starting to center ourselves, from a place of joy. So I think that that's a really important component to integrate in there, is like just scanning back through your wins, then also not being just eternally optimistic about everything, also coming back and saying like, how could I have improved today?
Hmm.
So coming at it from like a business lens, and saying like, hey, cool, great, did a great job, and what can we do better?
I love that.
And so I think that's a really powerful way just to kind of create a little list. And once you write things out, they become real and organized, and you can look at it and hold it. And then the same thing the next day, come in and say, cool, like what are the two things that would move the needle for me tomorrow?
Hmm.
And really waking up already primed to own that day, to use Aubrey Marcus's term for his book, Own the Day.
It's really cool. You're like, there's actually a beautiful quote in your book, and I'm going to paraphrase it because I don't remember it verbatim, but it's basically like, what you want to, before going to bed, it's really interesting to think about seeding your subconscious
Yeah.
with with your intention for the following day. Like to seed your subconscious, because your subconscious does all this work overnight, right?
Yeah.
And and yeah, you have the ability. It's like this really powerful window of opportunity before you go to sleep to plant the seeds of what you hope your consciousness will grow from itself the next day.
Yeah. And then within that, with seeding, there's a term in relation to plants. It's called, I think it's referred to as thigmomorphogenesis, and essentially is you can bend, say, like a bonsai tree or any kind of plant to fit whatever your vision of how you'd like it to grow. But
Mm.
that also happens anytime wind is exposed to a tree or any kind of plant. That thigmomorphogenesis is their response to their environmental conditions to grow to match the shape of their environment. And so you're doing that throughout the entirety of your life. Right now, as we're sitting here, we are, we're a term from a biological human term is mechanotransduction. Katie Bowman goes deep into all this stuff. I just recently recorded a conversation with her just a few weeks back, so all this stuff is fresh from her mind as well. But as we're sitting in this position, we're mechanotransducing ourselves to fit this shape of this chair. So as your bum is pressing against the bottom of that chair, you're creating electrical charge in and around the connective tissue and the bones that are feeling that pressure. So that then creates a response, electrical response called piezoelectricity.
Hmm.
And then you have these cells that either build tissue up around that space or break tissue down. Osteoclast, osteoblast, you've heard like blast class cells.
Yeah.
And so right now, and we're going to get into how this relates to like being better in the morning, but right now, anyone listening to this, and you and I, we are literally architects for our body as we're sitting here. Like we're training right now, and our body is it's growing to fit this position. Where that becomes interesting from a mental emotional perspective. And we include this research in the Align Method book as well. It's from San Francisco State University. They did interesting study with students where they found students that were hunched over into, in the book we call it like a mopey archetypal position, kind of like hunched over, forward head posture, rolled forward shoulders, spine rolled forward,
You're describing how I'm sitting
knees
pretty much right
collapsed
now.
in, all that
I
stuff.
always become a lot more posture conscious whenever I hang out
Well,
with you.
I'm really describing modern culture, as a widely modern culture, that's, and it's not a moralistic judgment, like it's bad or good. It's just that the general postural, musculoskeletal patterns of the day are veered towards collapse.
Hmm.
So when you're sitting down on a chair and your pelvis is wrapped underneath and your head is rolled forward in that forward head posture, shoulders are going forward, you're creating kind of like dams and blocks in those various different joints that, they They perform optimally when they have full functional range of motion in all directions. And when they get blocked up, then the body starts to kind of uh, it inhibits itself to be able to express with its full potential.
It's amazing that we can talk about this in the language of anatomy and physiology when like ancient um is it like Ayurveda or something? Like the language of chakras, right? Like
Yeah,
sitting
sure.
sitting straight so that your chakras are aligned,
Yeah,
so that you can then project out with your third eye. This is not a language that I'm used to speaking,
yeah,
obviously, clearly, but it's funny that they overlap, that they're
yeah.
so analogous to one another,
And
right?
and the chakras, which chakras, I mean, there's a lot of different systems. Maybe there's 7 chakras, maybe there's 12 chakras, depending upon the system you're looking at. This is not my area of depth at all. But what I think is interesting about it is those also relate into Western anatomical speak to some degree because they're areas of complexity in the body.
Hmm.
So the root chakra and the pelvic floor and the abdomen and the heart and the throat and the brain, the third eye, all those places are places of complexity. There's nerve ganglia and arteries and lymphatic glands and all this stuff. So if you look at the body kind of like a highway, the nadis is the term for the kind of like rivers. There's like energetic rivers, like the meridians. Those would be individual roads going down through the arms and kind of interconnecting throughout the whole entire body. And then in places like the elbows or the wrist or the shoulder or the heart or the brain, those are areas of complexity where all of those roads are conjoining into one. And then we refer to that as a chakra,
Hmm. I love this.
which is very interesting.
So is this why people recommend why meditation teachers recommend sitting in an upright position with your spine straight?
So this is what I was getting to with the San Francisco State University stuff. They found that the students that were in hunched over, mopey positions, it was easier for them to access more depressive memories.
Wow.
And when students would be in more of an upright, shoulders back, open up the throat, up the organs, it's just the general universal indication that you're winning.
Wow.
They
Interesting.
would be easier for them to be able to access more like uplifting memories,
Wow.
which seems maybe at first kind of like, oh, that's crazy. But if you even stew in it for half a minute, you're like, oh, of course. Like every person across the planet wins a race the same way. Every person loses a race the same way. We all get dumped by a girl the same way. The same postural positions and expressions of, oh, it's like it's this general sensation of collapse.
Hmm.
And when you're in that position in NLP speak, neuro linguistic programming, they have a term called anchoring. So maybe every time you do a podcast or do something that you care about, you might put some specific song on, or maybe do some essential oils. And so you are anchoring your senses to have this memory of, oh, when I smell this or hear that, I feel this way. So posturally speaking, we've been anchoring ourselves for millennia. When I'm in that kind of hunched over defensive position, typically this type of environmental stimulus is happening. I'm defending, I'm fighting, I'm sulking. And when I'm upright, arms up overhead, historically that would be the memories where I was winning.
Yeah.
And so when you are doing this, accessing your subconscious or asking a question of your subconscious, like the quote in the book, I think it was like Edison or something. I think it was like, what did he say? He said, never go to bed without asking a question of your subconscious.
Yeah.
Something
I like
that.
that. Something like that.
Something along those lines.
Beautiful.
Yeah. Just having some relationship with that,
Mm.
that like inner speak, inner voice. A beautiful opportunity there as well is to start to pay attention to your physical position while you're doing it.
Mm.
So a lot of in like the gratitude world or consciousness world, I think postural patterns and movement as a whole is it's like an underspoken aspect of it. And there's a lot of riches if we turn that stone up over, just paying attention to the postural patterns as we're doing the things.
I love it. So as we're preparing for bed to optimize our morning ahead,
Yep.
what else are we doing to optimize sleep? You've actually changed my sleep.
Mm.
Yeah. Remember when you stayed over at my house and you were like, the lights are just way too bright up here. I now, when I'm getting ready for bed, I don't put on the overhead lights.
Right.
I don't put on the overhead lights. I have a red light bulb in a lamp by my bed, which I use exclusively when I'm winding down for bed. And I don't even put the lights on in my bathroom.
Yep.
I have like a little tiny red night light that is very dim, and it provides just enough light for me to see what I'm doing. Flossing my teeth, brushing my teeth, peeing before I go to bed.
Yeah.
And that's pretty much it.
Yeah.
I'm getting to bed and I feel like a hunter-gatherer while I'm doing so.
Yeah. Well, that's what we were talking about that before on your, or I guess on my podcast before this recorded. And throughout our days, we're kind of we're in this liminal space of light where we're not getting full spectrum sunlight. We're getting kind of this like junk light throughout the day, LEDs and such. And then when we go to bed and our bodies are craving that darkness, now we're still getting this blue light. So that's this ongoing blur of, it's kind of dark and kind of light, but we're never getting that not never. But it would be more idyllic if we could start to instill full darkness and full spectrum light throughout the day. Allow that the pendulum to fully swing.
Yeah, most of our mornings are not bright enough, and our nights are not dark enough.
Yeah. And so when you are going to bed, that's a really beautiful thing. Start to light candles, maybe get a salt lamp. If you are just all you have at the place that you're at is blue lights, you could get some blue light blocking glasses. If I travel, I'll bring candles with me, just because it's just nice. Think of the way that when you are with a partner, like a romantic partner, how do you romance your partner? You might light some candles, you might play some soothing music, you might like tidy the place up, make it feel good, make it feel clean.
Make them a steak.
You might make them a steak. You might like burn some wood or incense, or or essential oils. So we do all that stuff for someone else, and it makes it feel away. And the next day you wake up, you're like, that was the best night of my life. Because we had that accountability and that opportunity to be able to really treat someone else the way that ultimately I think that, we all like to be treated. But sometimes it takes someone else to be able to have the reminders like, oh, this is what it feels like to treat a human right. So if we can start to instill that into our own practices, it doesn't need to be super like weird. You don't need to like play romantic music or whatever you want for yourself, but like romance yourself a little bit, I think.
I love that idea.
And something as simple as just clean up for yourself. Make the place smell nice for yourself.
Put on a vibe. Put on like your favorite music. Yeah.
For yourself.
Light some candles. Set the like mood lighting. Set the mood.
Set the mood. And then that also, sets your whole endocrine system to be able to produce effectively. It's like you're tuning your neurochemistry all the time.
I love that.
With your environmental conditions, light is one of the primary ones.
Hey, if you like that video, you need to check out this one here, and I'll see you there. What I think a lot of people don't realize about caffeine is that caffeine is not creating energy from nowhere, right? It's like there's no such thing as a biological free lunch. So when you're getting what you perceive to be an energy boost from caffeine, you're actually just borrowing it from later. It's like you're taking an energy loan out. Yeah. But that loan has to be repaid, and it's gonna be repaid in the middle of the day.